Welcome to episode 385, where I'm speaking with Dr. Sujatha Kekada about the Ayurvedic perspective on inflammatory conditions in the urinary tract. Conditions like UTIs, cystitis, kidney infections, kidney stones, and so on. Dr. Sujatha also shares lots of preventative tips, so please stay tuned. Hi there, I'm your host Colette, and on this podcast I will be sharing the teachings of Ayurveda, yoga, and holistic health practices. Now, if you're new to Ayurveda, I recommend checking out the first couple of episodes where I do an introduction to Ayurveda and the mind-body types. Thanks for listening, and now here's a new episode. Hello and welcome back to the Elements of Ayurveda podcast. Today I have our regular guest, Dr. Sujatha Kekada, who is the head physician and co-founder of AmrtaSiddhi Ayurvedic Clinic in Ubud, Bali. She is a certified Ayurvedic doctor with a degree from Rajiv Gandhi University in India. And Dr. Sujatha's profound understanding of Ayurvedic medicine and her deep love for plants is the basis for her exceptional ability to diagnose the root causes of disease and to find effective remedies. She combines intuition and compassion with bright intelligence and a rock-solid pragmatism. And she is able to effectively guide people truly individually, just as the spirit of Ayurveda demands. Dr. Sujatha, it's great to have you back on the podcast. Welcome.
Hi, Colette. Thanks for having me again.
Always a pleasure. And today we're going to talk about the urinary system and in particular inflammation in the urinary system. What I'd love to begin with here is the Ayurvedic perspective on the urinary system or Mutra Vahashrotas. The functions of this Shrotas, our channel as well, would be great to cover.
Mm-hmm. Yes, urinary tract or urinary system in Ayurveda we call Mutra Vahashrotas. A lot of the different systems in Ayurveda defined as Shrotas. It's a channel which carries different functions. So Mutra Vahashrotas means something which carries the flow of urine. So the two main organs related to this, according to Ayurveda, is Basti, which is our bladder, and Medra or the penis and the urethra. So these are the two things, urethra particularly related to women and penis particularly related to men. So bladder and penis. So that means it's a combined understanding of urogenital system for Ayurveda. So it includes urinary system and genital system when we're talking about urinary tract infections. So the main function of urinary system is to remove excessive kleda. Kleda means moisture. Our body needs moisture for its survival and function. But when the moisture is too much, the physiology is going to be affected, or what commonly in Chinese medicine it's known as dampness. Or if the moisture is not enough, it's going to create a lot of dryness and also hinders the physiology. So body works hard to maintain a certain degree of moistness in the body and whatever is the excess, because we constantly increase the moisture by drinking water, intake of too much of food that contains a lot of fluid. All those things can increase. And metabolism itself releases water. Right? The end product is carbon dioxide and water is released when the cells use the nutrition. So this water need to be removed, what's excess, to prevent any too much dampness, wetness created around the cells, inviting stagnation and infections, etc. So our kidney works in removing excessive kleda, and that's being carried out through the ureters into the bladder. And from the bladder, it is removed through urethra. So this is the whole mechanism of the kidney, and the Mutra Vahashrotas works on removing excessive kleda from the body.
Great. Thank you for that. And I remember when studying this channel, it was saying how Ayurveda believes that the formation of urine starts in the colon, whereas in modern science believes that it starts in the kidneys. Can you elaborate a little bit on that? That, it's an interesting difference there.
Yes. Talking with the word kleda, that means extra moisture, right? So when the ahara pachana, the digestion of the food takes place, the large intestine, colon, removes extra moisture, which is already in the food that doesn't need to become into the fecal matter. The fecal matter need to be, it should contain moisture, only certain degree of the moisture. It need to be solid. So whatever the excessive moisture that should not be in the feces is already removed. That means the process of removing the kleda takes from starting with your unwanted thing from the food. So it takes a first degree of removal of the kleda. That means your feces need to be perfectly formed. So that's the function of the kleda maintenance. It goes into the bloodstream, and then it, along with that, it carries some nutrients too, and then circulates, moisturizing the different part of the body. And as it goes into the cells and carries the further cellular metabolism related water, and then it comes to the kidney through the venous circulation. And then it also filters out whatever is not needed for the body, the metabolic waste, and removes through the urine. And whatever need to be kept, it need to be going to keep it. So the filtration system helps to remove excessive water, some unwanted chemicals, metabolic waste. And it also helps to keep something what we need, like a potassium need to be kept, or excessive salt should not be removed. So this way. In this way of seeing, the retention of the kleda, or maintaining a perfect moisture where it need to be, begins at the level of our colon at the stage of formation of the stool.
And can you tell us about the doshas involved or sub-doshas involved in Mutravaha-shrotas?
Basically, there is a 3 dosha involvement in the Mutravaha-shrotas. Anything to flow, the main dosha is vata. So vata is a primary energy here. So to flow need to happen. Any shrotas need to flow. It means it's a pulsation in the shrotas. Pulsation is always done by vata. And then involvement of kleda, it's basically Mutravaha-shrotas is working on maintaining this fluid balance. Then obviously it's working with the kapha. Any function of filtration to happen, it's almost like the process of heat, evaporating, condensation, this transformation process, we need the presence of heat, which is represented by pitta. So all the 3 doshas are involved in the Mutravaha-shrotas, but primary is vata, and then directly working with the moisture, the kleda, which is a kapha element, and the whole process of urine formation, we need heat in there.
Okay, great. Now, as I said a moment ago, we're focusing on inflammation in, and particularly inflammatory conditions within this system or this channel. And let's start, first of all, with the root causes of inflammation in Ayurveda. Obviously, there's lots of different things that can cause inflammation, but if you could cover some of the typical root causes, that would be great.
A typical thing to remember when we talk of the inflammation, there must be some heat, right? So that's what the word inflammation, which indicates heat and tenderness and swelling in a general term of a medical description of inflammation. So heat is needed. So anything that increases pitta in the body, and particularly we talk in more in details, when it comes to imbalance in Mutravaha-shrotas and causing the diseases of urinary tract, one of the biggest causes is heating food. Heating food which is very penetrative in nature, which is intense in nature. And these qualities are very similar to the qualities of pitta. So that means anything we do to increase pitta is going to increase inflammation in the body. And it's very so much so in the condition of UTI infections. So anything excessive exposure to heat, like too much sunbathing, too much heat therapy of steam or sauna or eating spicy food, too much of alcohol, here, these kind of things, acidic food, all these things can increase pitta and can lead into inflammation. Not only that, another cause to see is ama. Ama doesn't need to be always too much of pitta, but ama could be more on a kapha kind of ama, which becomes stagnant. And one of the cause for inflammation is irritation. So it's like, you can take a little sand particle, you go to the beach and you wear a flip-flop and you can get the sand particles in between your flip-flops bar, right? So, and then you can get irritated, and then you can have a red and blister and inflammation. So same thing, accumulated ama becomes an irritant around your cells, inside your cells, and organs and membranes and stuff. So that can also cause inflammation. So you can have inflammation directly coming from ama, could be more in a kapha nature, or you can directly increase your pitta and you can get inflammation. Either both of them can affect here indirectly in creating disturbances to the urinary tract and manifest different inflammatory urinary system diseases.
Okay. And so let's take a look at some of these common conditions related to inflammation in the urinary channel. The first one being burning urination. With burning comes heat, right? So you're feeling, when you're urinating, you're feeling the heat and you're feeling that stinging or burning sensation as well. So we're presuming then that pitta is involved there.
Absolutely. Yeah. In the description of Ayurvedic diagnosis of Mutrakrishra, the primary three thing is Vataja, Pittaja, and Kaphaja. So your general classification could be of this. When you have a burning micturition, it is involvement of Pitta. And when it is very painful, it will be involved with Vata. And if you have swellings and distension, then there is involvement of Kapha.
And so whatever aggravates the doshas involved could be aggravating factors here. Is sugar a factor, excess sugar in the diet a factor in something like burning urination?
Yes. Sugar. We're talking about not the general madhura rasa, what we call, because sweet taste is needed in food. And we're talking here the sweet taste from naturally occurring fruits, root vegetables, wholesome grains and things. But we're talking here more when we're talking to understand the inflammation, if you talk about white sugar, right? It's just the pure sugar. It's very heating in nature. So that will, overconsumption of that more than what your body can tolerate and remove as a waste, it's going to create inflammation in the body. It's going to create heat in the body.
Okay. And then another one that has the symptom of burning urination as well is UTIs or urinary tract infections. This can, is often associated with women, but men can get it too. And you particularly see it a lot in the elderly as well. So let's talk about the symptoms of UTIs and what's happening in the body.
So urinary tract infection is UTI. So that means it's obviously there is a found infection in the bladder, in the ureter, or it could be in the urethra as well. So the common infection here is E. coli. E. coli is the common bacteria that causes UTI infection. And the other group of bacteria is Klebsiella and Citrobacter. So this could be when it is very complex and the doctor need to give you a cocktail of antibiotics. Then it's more than one kind of bacteria is involved. But E. coli is the most common, generally occurring UTI infection. So it can come with many different forms. I've seen in my practice, people only feel just difficult to urinate. The urine comes like a dribbled, or it can come pain just at the ending of the urination, or generally they experience a dull ache on the lower abdomen and the groin area. Or frequent urination that they need to go to the bathroom more often than usual. Maybe you're not passing out much urine. People can end up having, sometimes if the infection is very strong, your body is fighting, you can get fever and chills. So these are the common symptoms you may experience. Intensity can vary from person to person, and the degree of infection and type of the bacteria that involved.
Okay. And the urine is affected as well, right? With UTI. I mean, you already mentioned there can be frequent urine, but the color and the smell of the urine.
Yes. You could experience a strong smelling, milky, textured, cloudy urine. Could be dark colored urine. There's a possibility that you may have bleeding because of the infection affecting the urine pathways. Or particularly if you have stones and then infections. So urine can be offensive smell, discoloration, to smoky, to milky, cloudy, Sometimes Ayurveda also talks about one of the symptoms is having lots of froth in your urine. When you urinate, if you see in the toilet that urine makes a lot of froth, it also can indicate some imbalances and leading into some symptoms of UTI infections.
So that frothy or bubbly appearance to the urine would more indicate more of a vata imbalance. Is that right?
Yeah.
Okay.
Mm-hmm. Yeah.
And the smells, it's interesting how Ayurveda defines the smell and the qualities of the urine depending on the doshic imbalance, right?
Mm-hmm. Mm-hmm.
So for vata, it will be like that frothy, bubbly.
And also could be a little smoky, like a blackish smoky color. That's also related to vata. Be more yellowish related to pitta, or milky, cloudy urine related to kapha involvement.
And then pitta always has the stronger smell, right? Be more like a sour smell. And with kapha, is it true to say be more like a sweeter smelling?
More sweeter smelling, and also it could be bit how you can say something rotten. That smell also related to that.
Okay, interesting. And then cystitis is another inflammatory condition, and that's more inflammation in the bladder. Could this be a result of a UTI infection not being taken care of, and then the bacteria infection moves?
Absolutely, it's like the bacteria is traveling down to the bladder, or if somebody is prone to getting infection all the time, you might have a small number of bacteria adhered to the walls of your bladder. So this is where the very a chronic condition of cystitis, you will see those bacteria are constantly present in the walls of your bladder and they become irritant. So that's why when you go and check in the lab, unless you do a culture test, you're less likely to see any infection, but you're going to experience all the symptoms of UTI infection. So it's basically these bacteria lie in the walls of your bladder and they irritate, and your bladder is irritated and it's going to contract more often then, because whenever there is an irritation, it's like you have an itch and you want to scratch it, right? So it's when the bacteria are in the wall of your bladder, your uterus want to contract to get rid of it. So that's why you're going to experience UTI symptoms, because it's a very chronic, it's been present there. So E. coli is a very common bacteria that can live in the walls of your bladder.
Right. So that's very frustrating. And I have come across this with people that the reoccurring cystitis. And so you said you have to, because the bacteria is lying in the walls of the bladder, you're not going to particularly pick it up in a urine sample, that there has to be a culture done.
Yeah.
Okay. And then with that, you're getting, like you said, similar symptoms.
But you would feel that more deep inside your, about the pubic bone, there would be really heaviness and tenderness when,
the bladder is inflamed.
Area, in the bladder area.
Okay.
And you may feel the fullness and tightness in your groins also.
Okay. And then kidney infections.
Mm-hmm.
So what's happening in regards to kidney infections?
It's an infection, either UTI infection can travel up to creating a kidney infection, or it could be just a localized renal infection from various sorts of bacteria and stuff. Here, you may not experience so much of pain as such as a UTI symptoms, but you may experience the pain where the kidneys are, lower area pain, and maybe a bit of a radiating pain from your kidney to your groins. So this would be the most, like if it is only limited to your kidneys, this is what you're going to experience. And it could mimic also the symptoms like a kidney stones. You can have a kidney stone and infection, and you can just have a kidney infection, renal infection, and experience these symptoms. But if you have a kidney stone and infection, it would be very excruciating, especially if the kidney stone is going to move.
So kidney stone is made up of the calcium deposits?
Crystals, deposit, oxalate crystals. Over the time, they just accumulate and get dehydrated. More the vata, you're going to have this accumulation of these stones.
Okay.
Vata and kapha together. Yeah.
I was going to say kapha is the accumulation and then vata dries it out, and then it's trying to pass through the tiny passage from the kidneys
Yeah.
Okay. And that's what causes the severe pain.
Yeah.
Okay. So the stone trying to move down the kidney tube is causing the inflammation and the pain.
Yeah, irritation as it rubs through, irritates. It's like you're going to have a scratch. You can have a scratch on your ureters, the tubes that collects the urine from the kidney to the bladder. And that's how the bleeding happens, because as it moves through, it can scratch the walls of the urinary tubes.
Okay. All very uncomfortable conditions, I think we can say.
Yes,
very uncomfortable. I think as women, Manny, most of us have experienced UTIs at some stage.
I think women, because, our urethra is shorter than men. So, and it's more exposed to the outer world, right?
Right.
So we are more targeted in that way. And let's look into the cause of UTI infection, other than just understanding, yes, it's a bacteria. In Ayurveda, we call this whole condition as mutra kritra, which means difficulty in urination. So basically, that's what happens, right? The common symptom is very painful, difficult in urination. Going to pee itself is a nightmare. So it's called mutra kritra, difficulty. So the cause is, it's funny that I'm going to say here, people might wonder, too much of exercise is one of the cause. Overly exercising is one of the cause for UTI infection. And then heating food and intense medications. Like that's why people who take medicine for something, like you can take medicine to cure a infection somewhere else, and you have, after a few days, you're going to have UTI infection. So you finish a course of strong antibiotics and you can get another recurring infection. So harsh, intense medication. And when you're taking this medication, if your diet is not good and you eat all spicy, pitta increasing food, then there is a chances of reoccurring of UTI. So heating, penetrative, sharp kind of food, or you drink too much of alcohol when you take medications, drinking coffee. And I'm not saying that anybody who does it gets it, but if you have a weakness in that area, which I will talk, what causes the weakness, that you might become a prone for this. And also another cause is too much of riding on like horses or on top of animals. I would say that this is more related to, in nowadays, riding on bicycles or motorbikes too long. Like as I'm talking, I remember my husband did triathlon, as you've been into that field. And, I remember him once mentioning the only one time he had that experience is when he had a long run of triathlon being on the bicycle. So long rides on these bicycles or motorbikes or on the top of horse. So these things aggravate because it's vata aggravating. And this also heat. You're sitting on a seat and you're constantly having that friction of that part of your body, right? So those things increases the irritation and the inflammation, and you end up having urinary discomfort. So we cannot say it as an infection, but it's a UTI, urinary tract inflammation for sure. And you will experience the discomfort. And eating too much of food constantly and experiencing indigestion all the time. These conditions, if somebody experiences this regularly, you're more prone to get UTI infection. They can trigger the UTI infection. Other important causes, what develops the weakness of your urogenital tract is suppressing urine. When you need to go to pee, and if you hold it back because you need to attend another meeting or you're too busy wanting to finish off something else, and withholding urine, and you drink water, you need to pee, but you drink water, you need to pee, but you're going to eat food, or you're indulging in sexual activities when you have an urge to pee. So this creates weakness in your genital area, and then you're prone to get vaginitis or urinary tract infection. So if you hold your urine, or when you need to pee, you end up drinking. When you need to pee, you end up eating or indulging in sexual act while you need to urinate.
Exactly. And I think as well, it's important particularly for women, because of our short urethra, is to urinate even after having sex.
Absolutely. Very much so.
Flush out that bacteria.
Yeah.
You mentioned vaginitis there. It's part of that urogenital region. So vaginitis, again, itis being inflammation. Can you talk a little bit about that?
Mhm. Inflammation in the vaginal area can come from irritation or all the symptoms, all the causes that what I mentioned could create that. Medication, or which also alters the pH of your vaginal mucosa, and you're more prone to infection. Increased pitta can create vaginitis. Same thing, the riding part, which is also for women, which is much more easier. And it can become from infections too. So different kinds of infection, including STD or a common yeast infection or some bacterial vaginosis, these kind of things can create this vaginitis, various causes. Then you need to treat it accordingly. But hygiene is one of the important thing here. And as I said, after the sexual intercourse, to urinate and drink plenty of water so that you can produce more urine and flush off. And then, if you're spending time in the public pools or sauna and things, to make sure that you wear your own hygienic underpants and things, and clean yourself. And it's another thing I commonly seen is also can be cause of UTIs. If you're prone for that, is you're staying in a wet cloth even after you go to a steam or a sauna or a swim. Staying longer in the wet, damp cloth can also trigger this.
Yeah, or even sitting on a damp ground or grass or something like that, right? Yeah, it can. Again, I guess it's too much of that clada, too much moisture.
Yes, too much of moisture. And it's easy for fungus bacteria to grow when there is a wet dampness.
Yeah.
It's a one important thing in Ayurvedic education. We talk about the two places. One is a dry place, which is desert-like land, and then is a marshy land where it is more wet, humid, all those things. And it says that the diseases are more prone in Anupadesha, which is wet, marshy land, and in the Jangala Desha, which is a dry land, which is more like a Mediterranean, less humid, drier, cooler, pleasant temperature. There you're less disease prone. That's why people who generally come to Bali, and if you're from a dry weather and you come to this hot, humid, rainy season, you're prone to get these infections and diseases more, because wetness creates a good environment for these bacteria to be more alive.
Mm-hmm. Yeah, absolutely. Good point. We talked there about hygiene, and I think we need to talk about what you're using to wash your vagina and so on, but also the fragrances in detergents. And because of our short urethra, that we're very exposed, our vagina and bladder and so on is very exposed to these chemical fragrances.
Absolutely. And if you are a sensitive person, if you have a tendency to be sensitive to on your skin, environmental sensitivity or perfumes and colors and additives and things, you might be sensitive in that part of your body too. So using natural thing, one of the best thing in Ayurveda is, like, if you ever have any irritation, inflammation, washing that part of your body with the Triphala decoction is a great way to keep the pH balanced and reduce the infection if you are infected. Also regular for women doing, this is also a ritual, using like a yoni dhupana. That means fumigating the yoni, where you're going to put some natural aromatic herbs to generate the fume. Dashamula is one of the best things to use. You can use some Triphala, you could use some Nirgundi, and Chandana, like something you want, like a nice fragrant. You can use Boswellia, sandalwood, vetiver, these things, and doing the fumigation. So there are special fumigation stools you can, and if you have a nearby Ayurvedic spa. Yeah.
So, and yoni being the vagina.
Yes.
The yoni fumigation, yeah. So you're putting all these herbs, and it should be done in a professional environment. Yes. What else did I want to ask you about? Oh, yeah. So when we're talking about the kidneys, I think of like the adrenals sitting on top of the kidneys. And of course, our whole body is affected by stress, but particularly the adrenal glands and the result of excess stress on this area. You already talked about excessive exercising, which can lead to more stress in the body. But yeah, talk a little bit about the effect of stress on the urinary system and particularly inflammation.
Okay. What I've seen commonly, The biggest, the stressing part to have infections in the kidney and bladder is fear. So constantly having fear, like you're always afraid of things, afraid of your future, afraid of whether I'm going to be earning enough. So constantly living in fear is the biggest cause of UTI infections. So if fear is a cause, if you're worried about and scared of everything in your life, that you doubt and things, all negative things, so UTI is a very common thing. Fear, kidney, bladder, the origin point is fear. So if you're stressed because you fear everything, you're always in a position of going to be in danger, unknown, helpless. Right. So this creates stress and you constantly in a fight mode. Your immune system is low because when you have fear, if you're not going to ready to face it with the confidence, you feel helpless. You feel helpless and defeated. And at that stage, your body's immune system or defense mechanism feels defeated. And these kind of small E. coli and little yeast and all those things are around us all the time. And if you're constantly feeling defeated and helpless and not powerful, they're going to show their strength more than your body's own mechanism to suppress them.
Yeah, and like you said, fear is associated with the kidneys and the bladder. Okay. Mm-hmm. Also, I wanted to talk about prameha or diabetes, and one of the symptoms is frequent urination. We talked about sugar earlier, and sugar can cause inflammation, but is a person with high blood sugar or pre-diabetic, would they have more tendencies towards these inflammatory urinary conditions?
Yes, because their blood is more acidic because the sugar levels are not maintained. When we talk about prameha, is a disease of excessive kleda. So the increased blood sugar is called madhumeha, which is one kind of prameha, which is we talk about diabetes. So the diabetes comes under the general category of meha, which means increased kleda. A body is not able to use the kleda properly, so it discharges the kleda even though it is needed for the body, so the body doesn't get nourished. So it's kind of body is flooded, the pipes are leaked or something like that, and where the water should be, it's not there. So hence the body trying to get rid of it because it only sees it as it's kind of messing up the flood is messing up the whole system. So that's why the frequent urination is a protective mechanism happening. And since this is kind of creating this messiness around your cells and stuff, the mechanism of pH balance fails, a healthy environment to keep the blood alkaline fails, and then your body's barrier to prevent the infection reduces. So that's why you end up getting most frequent infections, not only just the UTI infection, any other infections are much more prone in diabetes than a non-diabetic person.
Okay. And I think we need to talk a little bit about hydration, of course, because that's going to affect our urine output. But is it correct to say that a cause of aggravation in this channel could be too little hydration, which is obvious, but also too much hydration?
Exactly. Yeah.
Okay.
So too little could be an issue too, because it's going to increase the concentration of the urine and it's not enough to be eliminated. If the urine stays too long in your bladder, you attract more bacteria because the freshly formed urine to up to a certain period of time, it's sterile. So after a certain period only, it loses its sterility and it can attract infections. So drinking water is also it's not a fixed amount of liquid that everybody needs. In a modern world, we say drink more, the better. Hydrate. The word hydration doesn't mean you need to drink. The hydration is the ability of your body to absorb water and keep the moisture to a perfect degree that it's convenient for the body to function. It's not just about drinking, right? Hydration is not drinking. So it's ability to absorb and use by body tissue. So different constitution needs different amount of water. If you generally feel for your own thirst, Vatas rarely feel thirsty. Pittas are the one who constantly feel thirsty. Kaphas also somewhere in the middle. Kapha generally has a lot of moisture, so that's why they don't need so much of water. Pitta, heat, it just evaporates everything as their metabolism, physical activity increases. They sweat a lot. They need to maintain this good degree of viscosity of their blood. They need more water. And Vatas need snigdhata, but maybe not necessarily. It's all need to come from water. Snigdhata is moisture, but it's not just the water moisture. The moisture we talk about something which has got an oily nature. So that moisture is much more needed. Yes, Vatas need water. That means the consumption of water can vary. So I usually tell people that if you're an average physically active person, make sure that you get 1.5 liter of water. That's enough for you to carry your physiology. Like, you may go for 2-3 kilometers of walk on a daily basis of your physical activities, and maybe 2-3 times a week you hit the gym, and the rest of your job is on a desk and you play with your kids. And if this is average, you're not physically training or something, 1.5 liters of water, including your 2 cups of tea, is enough for you. And make sure you eat more moist food, like a juicy, watery food and fruits, because this brings a lot of water to you. And plus, you add more water into your daily consumption. If you sweat, if you do a lot of exercise, you sweat, you drink. You pee, you drink. So after peeing, you drink. After sweating, you drink. And if you're going to spend a lot of time in the heating environment and you're going to sweat naturally, you drink. Other than that, if you keep like 1.5 as 1 to 1.5 as a general guideline for liquids, including your tea, that should be enough. But if you're a pitta, you would need more water. So you replenish.
Okay, great. You mentioned there about, lack of hydration, meaning a higher concentration of the urine in the bladder. And it made me think of making sure that you're emptying your bladder. It's a lot of times going to urinate quickly, in, out, done. But it's important to make sure you empty completely, right?
Yeah, you sit there. Generally in Ayurveda, it says when you pee or defecate, you're going to clench your teeth. you're going to not sit with an open mouth or something. You're closed. And because you pay attention here, and you're clenching it, and then you let your mind is not distracted anywhere. You're just focusing this, so you empty the bladder easily.
Yeah. I want to talk about, we know that each treatment protocol needs to be tailored to each individual, but could you offer like some general tips? But I think most importantly are in tune with Ayurveda, preventative tips.
Yeah. Once you have heard me saying the causes, right? Prevent any cause, those causes, particularly withholding the urine when you feel the urge. It's also one of the cause of the disease in Ayurveda we call controlling your vegas, vega dharana. That means you withhold the vega. Vega is something to check, to correct the physiologies. Like when you feel like something's stuck in your nose or respiratory tract, you're going to sneeze to release it, right? So the vega to hunger is a vega, which tells you need to eat. Thirst is a vega. And needing to urinate, the sensation to urinate is a vega. Sensation to defecate is a vega. When you feel sad, you need to cry. That's also vega. And we need to attend those things because it creates a flow correction. And withholding that vega is one of the worst thing you could do. So try to avoid all those things. Personal hygiene would be the next thing to keep yourself clean, particularly even after urination. I think in the Western world, we use tissue paper, which is not the ideal way for the hygiene. But whenever you can, cleaning with water or something would be ideal. And then proper hydration. Once you got this guideline for whatever the quantity that's would be beneficial for you. So understand your body and sweating, and then increase then the basic guideline that I have given you. Avoid excessive heating food, alcohol, too much of coffee, on the top you're smoking, all those things, avoid that. What you could do more is If you have an infection, general remedy, you want to keep everything is cooling and something which has a diuretic in nature. That means which enhances the flow of urination. What is good in this category is barley is a very good grain to consume. Older the rice is better, which may be difficult to find nowadays unless you are a farmer. But barley you can get, so you can cook with barley, make barley soups, or you can make barley tea. Like if you go to a Korean shop, you can buy this roasted barley tea, so which you just boil and drink like a liter of that liquid when you're feeling this. Coconut water is excellent to cure UTI infections. Buttermilk is very good. The only one condition here, usually in any diseases, yogurt is not recommended, but yogurt is recommended in when you have UTI infections because of the probiotics, which will help with the bacteria. So you see, the concept of the probiotic right usage has been existing back then, but you need to use it right. Mm-hmm. So here that can help. What else can help is cucumber is an excellent thing. Cranberry is an excellent thing. Amla fruit or amla juice is an excellent thing to use here. And then there are classical medications, Bruhatyadi Kashayam, Gokshuradi Kashayam, Punarnavadi Kashayam. All those things can help if you kind of using medicines. So these are the common things. Oh, another excellent thing you can do is cardamom. Cardamom tea, or just simple, open a cardamom pod, put the seeds in your mouth, chew it, and then you can drink while you're chewing. You can drink a couple of glasses of water while you chew it, and it really makes a difference.
So what's the properties in cardamom that helps?
Cardamom is relaxing. So it's also good in drinking as a tea when you're stressed. Mm-hmm. It's something brings in Ayurveda, or in a Sanskrit word, we say the word called ahlada, something which refreshes, something which is like you laugh with lightness. So it's just a openness. So cardamom has that fragrance plus the quality. It has a cooling thing. If you have eaten a cardamom seed, it brings a little bit of a cooling, like a menthol effect. Yeah, so it's very good for Vata because it's Madhura Rasa, and also it's relaxing. So it's a perfect to anything which is tight and rigid and constricted. So
and Madhura Rasa being the sweet taste.
Yes.
Okay, and then I want to ask you about cranberry. So cranberry is astringent, so is it opposing the Kleda?
It's opposing the Kleda, and also particularly with the E. coli, astringent makes it not able to stick to the walls of the bladder.
Okay, very good. And barley is the same. Barley removes excess moisture. Okay,
and it also has a diuretic property.
Okay, yes. And then you mentioned yogurt and buttermilk, and I'd love for you to give a simple recipe that people can make for buttermilk using a probiotic yogurt.
Mm-hmm. Buttermilk and yogurt have a completely different property. The buttermilk is considered to be more absorbent. If you have a diarrhea, you want to drink buttermilk. If you have a constipation, you want to take yogurt. So yogurt has more lubricating quality and buttermilk has more drying quality. So if you want to make buttermilk out of the yogurt, I would say you take half a cup of yogurt and half a cup of water. You put it in a jar or in a blender, and you just want to put an ice cube into it, and you just blend it for 60 seconds, or as my mom used to do when we were a kid, or this is the actual process of manthana, churning, where you convert the yogurt into buttermilk. So basically you churn. The name buttermilk means it's milk or a liquid left after the formation of the butter. So you need to churn the yogurt, the full cream yogurt. So you remove you separate the fat from it, which is the butter, and the left liquid is buttermilk. So that's why it is more drying. It is not containing the fat, and it helps with the digestion because it still contains the probiotics, but it's not as wet and heating as yogurt. Yogurt is heating. Buttermilk is not that heating.
Great.
Blend it with half. And with the ice cube, because ice cube helps to the fat to come to the top, and then you skim it off the fat, and the liquid is the buttermilk.
And so you could add some cardamom
Yes,
in
you
there.
could add cardamom into it. And, if you are using some like a natural sweetener, this is like if you not to use white sugar, but you could use a little bit of jaggery, because jaggery is helpful in UTI infections too. So you could put a little bit of jaggery and cardamom. It makes a fantastic drink. Or you can have savory buttermilk with the cumin powder, a little bit of coriander, chopped coriander, and pinch of black salt or regular pink salt would make a nice drink also. Savory.
Okay, very good. Great. Wonderful. Thank you for sharing all that. And then talking about preventative tips, Ritucharya, cleansing at the joint of the seasons is important here.
Mm-hmm. Kleda increases during the rainy season, and that's also the reason generally doing panchakarma, not for a disease, is recommended to do in the beginning of the rainy season. So Kleda increases and your Agni is weak, so chances of getting disease is higher. So periodically doing cleanse at that time, Ritu Sandhi, and also summertime is easy for infection because of the lifestyle. You go in to spend time in the pool and water and stay wet and all these things. So keeping yourself more cool as possible, not reduce the consumption of alcohol, coffee at that time, you can naturally prevent the possibility of the infection. And try not to take unnecessarily antibiotics and steroids. They have a life-saving property, but use it when you need it. Not just any infection, any fever, just don't pop in pills.
Okay. Yeah. Very good point there. Yeah. So spring season, or wherever the climate is very wet, maybe melting snow, lots of rain, the ground has that Kleda quality, full of moisture. That's when it's a good time to dry out the system a little bit.
Definitely spring is a good time to do a cleanse, because kapha problems, skin issues, allergies, sinuses are very common. So spring is a good time to do a cleanse if you're prone to kapha diseases. Yes, absolutely.
And as Ayurveda recommends, at the transition between spring into summer, and then at the end of summer too, with the buildup of heat in the body.
Yeah.
Okay, great. And before we finish up, I'd love for you to tell people, if they're interested in doing a panchakarma, where they can find out more about you and the Ayurvedic clinic, AmrtaSiddhi in Ubud.
Yeah, if anybody interested further to explore your health through Ayurveda, we are in Ubud, Bali. You can look at our website, www.AmrtaSiddhi.com. And same AmrtaSiddhi is our Instagram page as well. So we always post different tips and information about Ayurveda. And also, if anybody is further interested in studying Ayurveda and yoga and any healing modality related to yoga and Ayurveda, soon we will be opening a yoga Ayurveda school. We're hoping that to be ready by June. And if you are in our mailing list or follow our Instagram, you should be able to get more information on when it is ready and different courses and stuff too.
Very exciting. Going to Bali to study. How nice. Dr. Sujatha, thank you so much. I'll put that link in the show notes. I always appreciate you coming on, taking the time and sharing this wisdom of Ayurveda. Much appreciated.
Thank you, Colette.
I hope you enjoyed that conversation with Dr. Sujatha. And if you think this episode will be helpful to family or friends, please share it with them so we can spread this wisdom of Ayurveda. Please check out the show notes for the links mentioned. And also, we just talked there about the importance of cleansing at the joint of the seasons. I want to let you know that my next group discounted cleanse happens March 28th, 2025. This might be a little too close to this episode airing, but just know that you can also do a private cleanse. The same structure, you just get to choose your own dates and you have me one-to-one for support. So if you're interested in doing a digestive reset cleanse to help clear out any accumulation of toxins, bring the doshas into balance and prevent the manifestation of disease in the body, then click on the link in the show notes or visit my website, elementshealingandwellbeing.com. If you haven't already subscribed or followed the podcast, please do so, and the new episodes will automatically download for you. And if you feel that you're getting benefit from this podcast, I would really appreciate a rating and review wherever you listen to your podcasts. Please come join me on social media. My Instagram page is Elements of Ayurveda Podcast, and on Facebook, it's Elements Healing and Wellbeing. Thank you so much for tuning in, and until next time, take good care of yourself, be well, and bye for now. Slán go fóill.